One of the best aspects of working for WPS is the chance to interact with professionals who are not only changing the lives of their clients, their patients, and students, but who are having a powerful, positive effect on their field. Dr. Linda McGhee is just such a person. She's a psychologist, an attorney, and a fierce advocate for her patients and their families. She hosted the Good Mental Health program on Radio 1, and she's the co-founder of the Multicultural Assessment Conference. And we are so fortunate that she is joining WPS for a series of ProLearn webinars this year. Thank you, Dr. McGhee, for joining us today.
So happy to be here with WPS and their efforts to spread the word and to create instruments that are multiculturally sensitive.
Well, we're delighted to be working with you. We feel honored and overjoyed. So let's talk for a minute about multicultural assessment. How does the lack of it have an impact on the students and patients and families that we work with?
The impacts can be, Rebecca, just complete, right? In terms of the awfulness of the impacts. It can do things from like keeping a kid out of a gifted and talented program. It could classify him as needing an IEP when he may not in fact need an IEP. He may in fact be traumatized and just need therapy. We've known that when people are misdiagnosed, it can impact their life trajectory, their life expectancy. They might get the wrong medications, and so they're off on the wrong path for a long time. And oftentimes, Rebecca, in the real world, when you get off on a wrong path, when you have the wrong diagnosis and you go to another treatment facility, that diagnosis follows you. And so people sort of take that and elevate that diagnosis without necessarily and giving it a lot of credence, when in fact it might be an incorrect diagnosis. And as I was telling you that I worked on a chapter in a book on bipolar. Again, that impacts your life expectancy, your propensity to have other issues, employment related. I mean, having a good, sound, culturally aware assessment can be life changing. It can change trajectory, and it can basically, even more than that, using a lot of clinical terms and a lot of sensory terms and a lot of economic terms, but it can really impact just the person's well-being and how they feel about themselves. So we want to get it right, right? And we want to be aware that being in various cultures, and so what we're talking about today, just so our listeners know, we're talking about race, ethnicity, gender, we're talking about LGBTQ status. We're talking about any ways that culture can impact lives, right? And so we're using that term culture in a broad sense of the word.
Right. I attended a conference this year, and the impacts of getting the language wrong, of not understanding the impacts of a language assessment can have powerful effects
You
on.
mean the English language assessment?
Yes.
Or giving the assessments in English?
Exactly.
Right.
And not understanding how the person's home language influences even the way they think about concepts that we.
And it's not that, and it's in its context. I think if you ask me what I do in my reports, it is placing tests in context, right? So, for some reason or the other, I might give them a test in English that knowing that 4 years ago they came from another country, right? But I contextualize it, right? So if I've made the clinical decision that I can give it to them in English, I contextualize it. I gave this to them in English. They came from Portugal 3, 4 years ago. And so therefore the verbal numbers in context
Right.
might be weaker,
Mhm,
right? And this
mhm.
is why I didn't refer them to get it in another language. I explained why I made the clinical decision to give them that test in English,
Right,
right?
right.
Because that too is a separate question from how they perform on the test, right?
Exactly. Yeah,
But it's putting the language and all of these things in context, and the context is the person's lived experience.
exactly. So let's wave a metaphorical wand and step back and adjust our lenses culturally. What should an effective, comprehensive, multicultural, culturally aware evaluation look like?
Well, it starts off with the clinician
Mhm.
being aware that their own perspective colors their what they write and how they test.
Yes.
What who meets in the clinical room and in the assessment room is the clinician's lived experience, the tester's lived experience, and the client's lived experience. And to understand that we are not blank slates. Okay, so just that understanding fundamentally that our culture and our lived experience meets the client's lived experiences. That's the one of the first steps in establishing and understanding what it is like to give a culturally aware assessment.
Mhm.
And then to train, to be thoughtful, to understand when you need supervision, to understand that it's not just giving the test,
Mhm.
it's how you set the tone in the assessment room, how you prepare the parents or the client for the process of testing,
Mhm. Mhm.
how you give the test. You know, expectations we know are a huge part of how people perform, and we give off our expectations in various ways, not just through our words, but our actions, our stance. Knowing that we need to be aware of looking for gifts and taking ourselves out of the deficit model of
Mhm.
describing children and describing what they're good at, and using language that talks about challenges, but also talks about strengths.
Mhm.
And understanding that the testing document is a living document, right? It should be a living advocacy document. So,
Yes.
you know, to understand that that document is going to go into the IEP room, into an employer's room. I mean, it's going to go someplace. And so to be a smart conduit, culturally aware conduit, an advocate for your client to take them through the processes of, like I said, before the testing and after testing, all of this goes into being a culturally aware clinician.
Wow. This is going to be a remarkable webinar. Um, so let me shift gears and let's jump back in time a little bit. The history of IQ assessment in particular in this
Mm-hmm.
country and in other places
Mm-hmm.
is pretty disturbing.
Mm-hmm.
And I'm
Yes.
wondering,
Yes.
it's the stuff of nightmares. Um,
um,
And I'm
yes.
wondering how exploring that and understanding the long trajectory of
Mhm,
IQ testing and other kinds of psychological testing, understanding that can reshape how we
mhm.
conduct assessments today.
To continue with what we've been talking about, is the context, right?
Right.
So we have to understand that we're doing an assessment in the context of our history in the
Mhm.
United States, right? And that history, racially, ethnically, is fraught with a whole bunch of oppression, prejudice, and discrimination.
Mhm.
And so when we look at the history of the IQ test, um, Mr. Binet in France created this test to merely measure where fifth graders were in school. In
Right.
fact, he was very adamant about the misuse of the test, right? And when the test migrated to America and Terman and some of his colleagues started to adapt it for use in education and military and immigration, they took Dr. Benet's tests and they used it as an instrument of oppression, right? It was used in education. They, a lot of the leaders in our field made statements about keeping out various groups of people from the country, separating out people in the military to make sure that certain groups racially and ethnically didn't get positions of power. And in education to sort of keep um, out of, to keep a dual level of education, basically, where by one group got the best services and the other group, and the child was educated fully, and another where children weren't educated fully, they were labeled as being less than intellectually. Um, and so that is the context by which we arrive at these IQ tests, right?
Mhm.
And
Mhm.
and so we're not just going in a room and testing a child. We are going in the context of history, and that history cannot be ignored as clinicians, right? I mean, in that way, we're in a struggle
Mhm.
because the very history of this country is painful in many ways. And a lot of clinicians, we want to internally believe that because we're in helping professions, that we don't have those sort of unconscious processes as our fellow citizens. And again, remember when I talked about the clinician meets the client in the room with
Right.
their lived experience, right? And these points about unconscious bias and conscious bias have been proven over and over again. So let me bring the context into a full circle. Let's talk
Okay.
about the good news. The good news is that we're learning about various groups in IQ, right? And we've
Right.
learned the gap between races is closing, right?
Right.
And we also understand that what we are measuring encompasses socioeconomics, quality of education.
Right.
So we are now know that this educational quality and the quest for education, um, and being in a home where education is elevated because of opportunities,
Mhm.
sort
Mhm.
of is all economics where you live in this country,
Mhm.
because school funding is based on home taxes matters. So all of these things, health exposure to healthcare, food, go into what a child could score on a certain test.
Mhm.
Obviously, trauma is another key indicator, and we know that people that are in various minority and marginalized groups have a propensity to be vulnerable to cultural stressors that can lead to psychopathology, but indeed impact performance,
Right.
right, in terms of intellect. So the work and the research that's being done now sort of gives us an understanding of what we kind of see anecdotally in the room, right? Where we see like really high vocabulary scores for kids who've been highly educated, whose mothers are educated, where we also see that getting a quality education stimulates our desire for more education. So it kind of gets the juices flowing, Rebecca. And so when people are in enriched environments, they're more likely to want to learn. I remember my mother getting me access to Head Start. I was in the first Head Start class in
Wow.
cohort in this country. And but it just sort of, I was a learner. I like to read, and being in enriched environments just made me more so to expose myself to more things. But we have to understand that not every kid has that access. And so those are some of the things that are feeding into IQ. So now we now know that race and ethnicity has sort of been a proxy for some of these other things, like economic, socioeconomic, being in a lower socioeconomic group, having less access to quality education, healthcare. So we thought we were measuring IQ, but in part of that IQ is this idea of what you've been exposed to and the
Mm.
kind of life that you've led before you come into Dr. McGhee's office
Right.
to have that IQ test.
Yes. So what I love is that you and your amazing colleagues, Dr. Hurd and Dr. Drummond, are continuing to bend that arc toward
Mhm,
a more just and accurate system of assessments. You founded
mhm.
the Multicultural Assessment Conference, and I'm wondering what led to that huge endeavor. And I'm also wondering what you're seeing in terms of the impact that that conference is already having.
So the Multicultural Assessment Conference was a sort of in my mind for a long time.
Mhm.
And then we hit a pandemic in the middle of it being in my mind. I was sitting on a board with doctors Tanisha Drummond and Shalina Hurd.
Mhm.
And we decided that pending COVID, we were going to do this conference. And all three of us, including myself, probably are out there speaking with the conference. But, you know, as you well know, Rebecca, I'm doing a lot of speaking outside of the conference because I don't
Yes.
speak at the conference. And so I'm going to address that question collectively. Like, what are we seeing? What's the input? Well, first of all, people don't have exposure to these kinds of trainings,
Mm-mm.
right? And to have a conference where you talk about everything from death penalty cases to deaf and hard of hearing populations,
Mhm.
to disabled populations, to Jewish populations, and to just get the information out there. I will speak from personal experience, being and scientifically, when you are with a group, when you're studying a group, when you're treating a group, you
Mhm.
learn,
Yes.
right? And so exposure to that is chief, you know, a chief learning thing. So one of the things that we've gotten out of it is that we've learned that people want this information and they want to understand that we want to give them the tools to operate in this changing country. And that's one of the things that I'm going to talk about in my first WPS talk coming up, is that this country is changing demographically and it is changing rapidly, far beyond the
Yes.
expectations of the demographers and census takers. And I in that part of the discussion, I'll give a sneak preview. It's called "And a Little Child Shall Lead Them," right? Because the population is getting browner and it's younger, and you know, so it is more claiming LGBTQ status.
Mhm.
So the population is changing. We are reporting like more people that are not married. So you know, just the very essence and fiber of America is changing, and we cannot, psychologists have to be on the forefront
Of
of
course.
making sure that we are in the treatment room and the assessment room incorporating those changes and being ready for those changes and not just tolerating them. But like I said, Rebecca, I want us to be at the forefront of the cultural shifts in this country and to treat people that come to us for whatever reason with
Mhm.
dignity and respect, and to nurture them as they go through the process. The
Yeah.
assessment process to me is a part of treatment. And, you know, those 6 hours that you spend or with that client might shape the way they look at psychology for the rest of their lives.
Mhm. Mhm.
So we're not just throwing blocks out there. Rebecca,
Definitely not.
you know.
So if you had to narrow it down to say, 2 or 3 takeaways, what are you hoping that people who participate in these webinars can come out with on the other side?
As with the Mac and my own training, I want them to come out with the fact that, you know, I will provide a safe environment for them to learn. We always tell people that they need to change, they need to get better, they need to become more culturally competent, but I believe that they won't do so unless they feel that it's safe
Right.
and that they can come in and they can say how they feel, and they can say that they're lost. And so that's one thing I want them to take away. The second thing I want them to take away, other than safety, is that it's possible to become more culturally confident and aware.
Yes.
It takes some work. And the third thing is to acknowledge that it's not always a smooth process. So, like, typically when people ask me what are the takeaways, I feel like I have to give them the whole picture. I want to normalize, as with everything else that you learn, you are going to make mistakes and it's not going to always be comfortable, right?
Mhm.
And if you can accept those premises that you are on a lifelong path to becoming more culturally competent,
Mhm.
and the path is not always linear,
Right.
then you can change. But any great movement, any great change, any great elevation of your skills and your talents and your gifts are similar, right? They takes a long time. It's a lifelong thing. And I am committed to be a lifelong learner. And there are aspects of culture that I am learning more about, that I have sent myself back for training for, that I have to make decisions about when the person calls me on the phone. Am I competent enough to do this? Right? That's
Right.
the initial question,
Sure.
right? If I'm not, then who is?
Mhm.
Right?
Right.
All is there someone out there? Can I do it with supervision? Right? Can
Mhm.
I do it with consultation?
Brilliant.
And where am I in
Yes.
in my quest to be a more culturally competent person, and to be real with the fact that sometimes that's not your client,
Right.
right?
Right. That's
you
wisdom.
know
That's
uh-huh.
wisdom. Yeah.
and
Well,
and we have to prioritize them, right? I'll just say that really briefly. They are the priority. Their needs are tantamount and paramount over our needs, right?
of course.
And so if we don't feel like we can serve them, then it's a ethical obligation to refer or to get supervision.
Right. Well, Dr. McGhee, thank you so much for giving us this glimpse into what's on the agenda and what's coming in these webinars. I know that they're going to be really useful to practitioners who are willing to take those steps. Thank you.
I'm looking forward to them. I haven't looked forward to webinars as much in a long time, and I'm looking forward to using my voice to help our field
Yes.
serve our clients to the highest ethical and cultural standards.
Yes. And I'm thrilled that WPS is going to help you amplify that voice even more. And I look forward to what we all learn together in the next Multicultural Assessment Conference.